Hey y'all, Kayla Mowdy, Doctor of Physical Therapy here. Today I'm going to talk about something that's very near and dear to my heart and that I see each day that I want to share with you so that you know what your options are when you're having a problem or when you've been diagnosed with a big, scary, nasty orthopedic tear or herniation or something that just sounds really bad and feels like it needs to be fixed. So the first one I want to start with is a rotator cuff tear. So in a study in 2013, Kuhn et al. Found that 75% of people with a full tear in their rotator cuff, full tear, were able to rehab their shoulder without surgery. So they came to a physical therapist. The physical therapist worked on it. There's actually 2 or 3 rotator cuff muscles that go each direction and some accessory muscles. They can all be trained to compensate for a tear. And this was a full thickness tear confirmed on MRI too. So they took all these people and they said, okay, so you're not a big fan of surgery. So let's try physical therapy and enroll in our study. And they found that 75% of those people did just fine without surgery, and then didn't have to go through the 2 or 3 months of immobilization and working back to get all the muscles that turn to mush while the healing is in the process when you have to have surgery and immobilization. There's also all these other studies. So Kuhn et al. Is a good one, but he's been in a couple of them, Catola. So I looked up those for you. If you want me to post links to those, I don't mind. The next big scary nasty is a herniated disc. So you've had an MRI and it says you have a herniated disc. You've been having sciatica off and on for years. So what does that mean? I will talk about MRIs next week. I'm going to try not to get off on that tangent today. But if you are having pain in your low back, chronic, new, old, please see a physical therapist before you let someone cut on you. That is a surgery. They're going to cut through all your muscles that are supposed to help stabilize the spine, and they're going to either just clip the disc that's irritating the nerve or fuse the segments so that they don't move anymore, so that you don't need those stabilizing muscles anymore. But they're still very important, and we want to work with you and get those going and see if we can get you feeling better without surgery. We have lots of things we can do. Number one, we can educate you on the fact that low back pain is not threatening and keep you moving, because that's the biggest thing is most people with low back pain quit moving, and they develop something called kinesiophobia, which leads to more weakness of the muscles. So this is a really cool thing here. This study that I found, it was by Bronx, and I'm thinking this is probably in another country, because what they did is it was a randomized control trial. They took 64 people with confirmed chronic low back pain. They all had MRIs. They had different problems each, but they put half of them in a physical therapy group and half of them in a lumbar fusion group. So half these people got fused and this other half went to physical therapy and also got cognitive intervention. So what we're learning as physical therapists is the cognitive part is just as important as the physical part, because we're teaching the patient to do certain things and to not be afraid of movement and to continue normal daily lives with the help of developing the stabilizing muscles around the spine as well, and whatever else going on. We have a lot of different methods and a lot of different methods that different PTs believe in, but the thing about it is they all work. The lumbar fusion did not differ from cognitive therapy plus exercise with a skilled physical therapist for reducing disability and chronic low back pain in the long term. I think they did a 1 and a 4-year follow-up on that. They lost a few to the 4-year follow-up, but that was still really good stuff. So you are an athlete. This may speak to the younger generation or anybody really that's out doing a physical activity and you have an injury and you tear your ACL. What do? So you have this torn ACL, it's broken, it's not there anymore. So everybody goes and gets surgery, or at least statistics say 90% of ACL tears are repaired. But there have been several studies. I got 3 here on that one. Fitzgerald is actually probably the most common PT study, but of course there's actually studies with non-PTs too, which is really cool when you actually get an orthopedic surgeon on board to test this. They call it Copers versus non-Copers. Copers can do without an ACL, developing the muscle strength around it. Copers tend to have less giving way. They do within 80% on their affected leg as their unaffected leg, and a couple other little tests that we as PTs know. So this study took 125 MRI confirmed ACL tears in athletes, and they actually decided using some statistical analysis and decided Copers versus non-Copers. So actually they did 37% originally tested to be a Coper. So 37% right off the bat they knew, okay, you're going to be fine without an ACL, you're good. And the others actually decided to go non-operative also just for this study, and they were actually athletes. So these are level 1 and level 2 athletes. So level 1 would be cutting and drills and stuff, and level 2 can be either an inline athlete or a person with a physical job. And then it's at 1 year follow-up, 70% of non-operative ACLs had returned to previous levels of activity. So in this study, out of 125, 39 ended up having surgery. And of those 39, a year from surgery, only 70% of those had returned to previous levels of activity. And I did find some studies that you will, not getting your ACL repaired has more motion at the joint. It can lead to arthritis earlier in life, but you can turn around and find that exact study for people who have had ACL replacement surgeries. They also get arthritis earlier in life, so it's very important to learn your exercises and know some stability drills and continue to do these stability drills throughout, whether you've had a repair or whether you've had, if you're living without an ACL like myself, actually, from an injury snow skiing. I was able to rehab that thanks to a very awesome orthopedic surgeon who saw that there was still some potential to not have to repair it and some stability left in the joint, and he sent me to PT, and that's kind of how I got into all this. So this was a great thing. I like to share the rotator cuff tear, the herniated disc, the sciatica stories, but the ACL is kind of close to my heart as well. I hope that y'all have a wonderful Monday. I'm going to leave it at that. I'm going to get into MRI next week, and I hope that y'all all, if you're having pain, if you've been diagnosed with sciatica or a herniated disc, that you seek out a therapist. Don't just take the medicine or deal with it or feel like, this is something you just have to do. 80% of people will have back pain over their lifetime. That's crazy. But we can help. We can make you feel better. We can help you continue to work and continue to do what you love to do, whether it's yard work or play with grandkids or play with kids, because I know that happens too at an early age, especially new moms and the stretching of the abdominal wall and stuff like that. So please see a physical therapist or ask me your symptoms, and I can kind of tell you if I think it's something that physical therapy would benefit. And sometimes people end up in surgery, but hopefully if you come see us first, we can help you along with that process and help you be stronger if you do end up having to have surgery. Going into surgery, most of the studies show that if you've had some prehab, the outcomes are a lot better after surgery if you still do need to have that approach as part of your intervention. Bye, y'all.